Hi everyone, my name is Ansu. I'm part of She Evolves to Empower, a group for empowering women. And today we have Dr. Shreya Soni, a naturopathic doctor, who's going to talk to us about polycystic ovarian syndrome and acne.
Hey everyone, I'm so excited to be here. There are a lot of natural solutions and treatments for polycystic ovarian syndrome, and I can't wait to share them with you. A little bit about me is that I practice out in California. I focus in hormonal balance for women, and my contact information is there below in case you have any remaining questions after this presentation. I'm a naturopathic doctor. Most people don't know what that is. Summary is that we do go to 4 years of medical school. I did my residency at University of California, Irvine. You get a medical license and it allows you to order labs, imaging, hormone supplements. The main difference is that we are really focused on why illness occurs. We tend to spend longer with patients. So initial appointments are typically at least an hour long. And that allows us to put together pieces about diet, lifestyle, nutrition, stress, the whole picture of you in determining why a condition is occurring. And that's ultimately what we want to treat. We want to create a state of health where there is no illness. That's just a cute picture of raspberries because they do look a little bit like cystic ovaries. So that's why we have that slide. PCOS, there is not a uniform definition about it at the moment. And so that's kind of what the purpose of this slide is. There's not an agreement, but there are different guidelines for diagnosing it, so I will get into sharing that. Mm-hmm. So it's a spectrum, and there's many different symptoms that we're going to talk about. If you are someone with PCOS, know that you are not alone. It is the most common endocrine, which means hormone-related dysfunction for women. Up to 25% of women have some form of it, and it's actually been documented as early as Hippocrates, so it's there since the beginning of medicine. They're a healthy part of the population. Fertility issues are a common concern, but since they've been there since the beginning of medicine and we're still here, PCOS women are still here, it doesn't mean you're infertile. It just means you're less likely to get pregnant as quickly, which back in the day was actually advantageous because having a smaller family meant you had lesser labor happening, and you were able to care better for those few kids that you had. So there were some advantages to it in the past. And other pieces of why it stayed in the population so long is that it is a metabolic syndrome where there is accumulation of body fat. And when there was periodic fasting, it was very advantageous in the past to have this genetic picture that looks like PCOS.
Yeah. Thank you. So how can you detect PCOS at an early stage, or what are the symptoms at an early stage?
Yeah, so the best way to detect it is to follow up on some of those common symptoms that come with PCOS. And if you switch the slide, we'll get to see some pictures of those. Mm-hmm. So things to look out for would be darkened skin at the back of the neck, skin tags, weight around the abdomen. Mm-hmm. Also, like difficulty getting pregnant, missed periods, longer time for your period, even painful period. Mm-hmm. Cystic ovaries, cysts that rupture for women, none of that should be neglected. Mm-hmm. And the fact is that if you do neglect it and you continue with this condition untreated, you're looking at some of the consequences of this PCOS picture, which include heart disease, fatty liver, diabetes. So it is important to treat it at the cause level. Mm-hmm. And as early as possible. So talking more about the symptoms, PCOS is a state of hyperandrogenism, which means that you have a lot of the testosterone hormones. Mm-hmm. So if a doctor suspects you have PCOS, they're likely to order blood work checking for these hormones, as well as imaging to see if there are any cysts on the ovaries. And then they're looking at signs on your body like hair growth, that's male pattern, cystic acne, as well as hair loss, that is male pattern.
So what are some of the natural remedies that you would recommend for PCOS?
Yeah, so there's so many, and the treatment is going to depend on what the cause is for you. If you're someone who it does show up that you have these high levels of testosterone, and this enzyme that creates this super strong testosterone is very active, then we might use herbs to inhibit the enzyme. So some herbs that help with that are saw palmetto, nettle root, polyunsaturated fatty acids. So essentially those are anti-inflammatory fatty acids like omega-3s in salmon. EGCG is this high antioxidant extract, but essentially you will be making lifestyle changes at the same time so that you don't need to be taking these herbs forever, but they are helpful while you're experiencing those symptoms. So just to repeat, we're also going to be talking about lifestyle changes for you to get started on, but while you're experiencing these symptoms, it is helpful to take these herbs in the short-term period. So here's another very commonly used herb for PCOS, and this is specifically for that hormonal acne that comes on the chin. Spearmint herbal tea has been found effective. You have to drink a lot more of the tea to get that effect. It's almost like 10 cups a day, but it's just a nice lifestyle thing to add in if you're someone with PCOS. I'm not telling you to drink it 10 times per day. I'm telling you to talk to your doctor about drinking it, but in general, a cup a day is pretty safe for most people.
So would you have to go first to your doctor, or
Yes.
can you just buy this tea and just drink it?
You should always go first to your doctor. Do not self-medicate yourself with herbs. You should go to a doctor who's studied herbs and herbal medicine. That is so important.
Okay.
So naturopathic medicine, we get 4 years of training and we're learning conventional treatments, but there's a big emphasis on natural treatments. We have a lot more hours in nutrition. So we really know how to use these herbs carefully.
Yeah.
So diet is the foundation of PCOS. It often deals with a lot of the causes of inflammation as well as the insulin piece, the blood sugar regulation. So it's important to eat a diet that's high in protein and fat if you have PCOS versus one that's high in carbs. Carbs are your refined breads and sugars. They cause your blood sugar to spike. And so we don't want spikes. We want to keep your blood sugar nice and steady throughout the day if you have PCOS.
Okay. So you should have more vegetables and fruits. Can you have fruits like at this point?
The fruits are a tricky one. If you have an issue with sugar regulation and it is significant, fruits are a source of sugar. I would say you should never have juices because those really spike your sugar. Fruits typically also have fiber with them. So for most women, it's okay, just 1 or 2 servings a day. But in PCOS, when we're starting treatment, it's likely that I'm not going to tell you, unless you have other things going on, it's likely that I'm not going to tell you to eat fruits. I'll be telling you to eat more of the chickpeas, lentils, plant-based foods. Like avocado is great, things that keep your blood sugar steady.
Okay.
Inositol is another very popular supplement that helps the ovaries, especially when you're looking at helping someone with PCOS who's interested in fertility. It does increase the chance of ovulation, and it also helps with stabilizing blood sugar. But one of the side effects can be that it drops blood sugar too much. So again, talk to your doctor about whether this is something you should try. And then when you do try it, use a good brand. And then exercise is another great intervention for someone with PCOS. It's going to be person specific. So if you're someone who's already very stressed out, exercise can stress you more, because it will release that hormone cortisol. So that's someone in whom you want to do more gentle activities. But say if your stress is well regulated, then high intensity interval training has good research on it for PCOS. So the more muscle you have, the better your insulin response is regulated, and there are better outcomes for PCOS. So it is a good idea to lose some weight using exercise before trying to conceive if you have PCOS.
Yeah. So is there anything that I could heighten my PCOS symptoms?
Yes, there's plenty of things, and it comes back to not following those lifestyle recommendations. So if you're going to continue a high sugar diet, which for me, I grew up in the 90s, I was having sugar and butter white bread sandwiches for breakfast. So that is something that would aggravate PCOS. I was drinking Starbucks Frappuccinos. That would aggravate your PCOS. So this is important. Eating and sleeping with the sun. Your insulin response is best during the daytime. So that is the best time to eat. And then fasting overnight is really important. So if you're a college student and you're pulling all-nighters, that's going to worsen your hormonal response and your PCOS symptoms. And so with fasting, it's best to make breakfast and lunch your biggest meals. They are important. It's important not to skip breakfast. But honestly, dinner doesn't matter very much. At dinner time, if the sun is set, it's a good time to fast. You can have a very light meal for dinner.
Okay.
Or skip dinner.
Okay. Can I ask you a question? So there is a lot of trend going with the intermittent fasting.
Yeah, I love intermittent fasting, but it has to be done correctly. Most people will skip breakfast, and that is not what you want for your hormones, especially as a woman. If you do fasting incorrectly, your body will think it's in a state of starvation, essentially, and it's not going to make you fertile. It can throw off your sex hormones, your thyroid hormones. So if I'm doing intermittent fasting with a woman, I'm likely to alternate the days and base it on her body type, but also I will emphasize that it doesn't mean you skip breakfast. It means you can skip dinner and make sure the breakfast is nice and heavy in the protein and fat. So essentially eat your dinner for breakfast. Don't have the high carb breakfasts.
Mm-hmm.
So pancakes and syrups are not the PCOS diet for breakfast.
Yeah.
But nuts and seeds are, avocados are.
Mm-hmm.
If you don't address PCOS at the cause, you should know that long-term unchecked PCOS increases your risk for heart attacks by 7 times, type 2 diabetes by 4 times, because we talked about the insulin piece and the blood sugar piece. So you're twice more likely to have metabolic syndrome, which includes abdominal weight gain. You're more likely to be depressed, have stress in response to lifestyle events, and then you increase your risk of certain types of cancer. And then if you're a woman getting pregnant and you haven't kind of cleaned up the lifestyle, autism itself is very rare, but unfortunately women with PCOS are more likely to have autistic kids. But autism itself is very rare, so I'm going to emphasize that. And here's another piece about why minority populations especially are very much affected by PCOS. It's certain dress codes, policies, skin lightening creams, all of that have a lot of harsh chemicals, and chemicals can aggravate PCOS. So in the next few slides, you're going to see more about chemicals that are in common women's health products that aggravate hormonal conditions like PCOS. So it's really important to read your ingredient labels on the beauty products you use, and make sure that they're natural. Anything that goes on your skin should be something that you could even eat, because when it goes in your skin, it doesn't have a chance to get digested and go through the liver. It goes right into your bloodstream and acts like a hormone. And so if you're using beauty products that have phthalates, parabens, triclosan, that's going to cause hormonal problems for you.
Wow, I didn't know that.
That's also why some of these conditions are so much on the rise, is because our exposure to these chemicals is on the rise.
Yeah, with the whole beauty routine that has been blown out for the past couple of years, especially makeup and skincare, I can imagine that it can affect more and more people.
Yeah, especially the products used every day, like some of the soaps and body washes, fragrances. Making sure those are natural, that's great. So makeup once in a while, that's okay. But if you're using something every single day, it's important that it's a clean product.
Okay.
So BPA is another chemical that's found in all kinds of plastic. And women with PCOS have higher levels of BPA. And BPA will also reduce the number of actual eggs you have and the number of successful births. It affects some of the energy production of your cells. So it's a chemical that is toxic for fertility, and in utero it can actually cause your future kids they're more likely to have PCOS if you're exposed to these higher levels of BPA. So again, BPA is something that's found in plastics. It's also on receipts. So they tell pregnant women not to handle receipts. Nowadays on plastic bottles, you'll see BPA free, but often they're just using BPS, which is an even worse chemical. So yeah, you will see some of that on the next slide. So this is about BPS, which is that BPA alternative on plastic bottles. So the exposure to these endocrine disrupting chemicals, they do affect your genes and your expression of the genes, and especially in utero. Yeah.
So can you have PCOS even if you don't have multiple cysts anymore?
So if you go to the next slide, that will help with answering this question. So these are the diagnostic criteria for PCOS. And as I mentioned, there is not a clear established criteria for PCOS. So you don't have to have polycystic ovaries to have PCOS. You might just have infrequent periods and the signs of hyperandrogenism, which is the male pattern hair growth and hair loss, or the cystic acne. So you could just have those symptoms and no cystic periods and still have PCOS. So it is possible to not have cystic ovaries and have PCOS.
How do you get diagnosed? Like, do you have to go to the doctor, and what kind of tests would they do to say that if you have PCOS or not?
Yeah, one thing I like to teach women is that it's actually possible to feel your ovaries yourself and know if they're enlarged. So if you I'll stand up. This is like my hands are my belly button, and where my pinkies go down, that's approximately where your ovaries are. And so you can check in and see if you have an enlarged ovary, and that's an important piece of information because cysts on the ovaries, they can be very painful if they ever rupture. And there are certain nutrients like iodine, especially, that is very commonly deficient in the United States, and just taking iodine will help treat the cause of the cyst. Not everyone should take iodine. There's certain conditions where iodine will worsen your thyroid if you have any autoimmune conditions. So please talk to a naturopathic doctor about it.
So can you heal completely from PCOS?
Yeah, I love this question. So if you could switch the slide. While there's technically no cure, by treating the cause like we talked about, which is lifestyle, diet, nutrition, PCOS can be managed to the point where you're completely free of symptoms. So yes, in my opinion, you can. So I'm someone who was diagnosed with PCOS, and so that's a picture of me when I used to have this cystic acne. And I didn't know it back then, but my lifestyle completely contributed to it. I would pull all-nighters in college. I would use, different kinds of chemicals and beauty products. I had inflammation. You can check for inflammation in your blood. I would drink those Starbucks frappuccinos, eat the 90s diet. And so that was all part of why I used to have PCOS. I did end up treating it with herbs. I found that, when I stopped the herbs, I would get my symptoms back. And so then I really went even beyond the herbs in treating the lifestyle piece. And I don't have any of those PCOS issues anymore.
So are you still on medication with the herbs, or did you stop completely?
Yeah, I'm not taking any herbs at the moment, but I know that, if I do end up having a lifestyle where I'm, due to social events, I'm stressed out more, or I'm eating certain types of foods more, I know how to access the herbs I need to, so I can use them when I need, because, your lifestyle is never going to be perfect. It's more about getting to know how your body works and listening. So for example, if I have a lot of flights I'm going to take, I know my body will be stressed out, and I might prepare myself with fish oil or other anti-inflammatory herbs so that I don't have to deal with acne afterwards.
Makes sense. Yeah.
That's just a repeat with my contact information if anyone has any more questions. My website is dr.soni, S-O-N for Nancy, I for India.com, or you could follow me on Instagram at @theEndoDoc.
Thank you so much. Thank you for this talk. It has been really interesting. Thank you.